Good morning and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast special today, we talk about the healthcare system in Mozambique with a focus on the challenges of healthcare in low middle income countries. I am Schmitt, and it is a great pleasure and honor for me to have today with me Dr. Delphine Goux. She's a special guest in our Healthcast. Thank you for joining us today, Delphine. And I know we have met many years ago, and then we lost each other, and I had no idea where you were until I found you somehow. What I know is you have been working, and you still are working, in Mozambique. So what have you been doing? What were your roles in Africa?
Thank you, Jill. Thank you for the invite today. Very happy to talk to you about the healthcare system in Mozambique. So yes, indeed, we met when I was working with Novartis pharma business a long time ago. And I decided to embark at that time on a more humanitarian journey. And so I left for some work in the field in Africa, and I ended up in actually Mozambique after Lesotho and Central African Republic. And I first joined Doctors Without Borders. I was actually health advocacy manager. So that means what I was doing is going to the field, finding what were the needs of patients that had HIV, TB, and take that needs and bring it back to the partners and to the government to try to shape health policy and support them in their access to treatment and diagnostic. When I actually left, after I arrived in Mozambique, I decided it's a very nice country. Mozambique is a beautiful country to live. And I decided that I'm going to stay there, and I'm going to, use my skills and open actually a consulting firm in health. So I would be offering, technical advice in different areas: sexual and reproductive health, infectious disease, HIV, TB, malaria, health system strengthening, immunization, social and behavior change, communication, etc. And from that time, I've been working with different NGOs in different areas. I also work for the UN with UNICEF, for example, for a polio vaccination campaign. And in the last 2 years I'm here, I've been working on the donor side with the UK government. So I can say that during those now 8 years in Mozambique, I have a very good angle and vision of how the healthcare system works. May it be from the private side, the academic side, the NGO side, the donor sides, and also, the big players, the UN and all the global health initiative side. So it's quite a broad and very interesting experience that I had.
From what I hear, you are the healthcare expert on Mozambique. And I guess before we go a little bit into details on the system there and how it works or does not work, can you give us some more background information on the geography, on the population, on healthcare numbers that are relevant for a country? Maybe you can give us some insight on these topics.
Sure. So Mozambique is actually a lovely country. It's not known enough. I think it will really benefit from having some tourists. Actually, it's beautiful landscape, beautiful beach, beautiful people. It's actually on the east-south side of Africa, close to South Africa. It is a very spread, huge country with 800,000 kilometers square, only 33 million inhabitants, but people are spread everywhere in the country. So it has very many geographical, urban, rural, and educational disparity. And on top of being very beautiful and have a lot of resources in its soil, like, gas and gems, etc., it's a very, very, very poor country. It ranked 185 out of 191. To give you an idea, only 30% of the people have access to electricity, 63% have access to water. The population is extremely young, 53% are under 17 years old. And there is a high fertility for women, 5.2 children per woman. And as the infant mortality is declining, there is a huge population growth that is expecting in the future and can be very alarming for the country if there is not enough economic opportunity for the youth. In terms of health, there is a huge maternal mortality of 300 per 1,000 live birth, 1,100, sorry. No,
100,000.
100,000. Sorry, I'm always having a lot of problems with figures in English. Under 5 mortality as well is quite high. There is endemic disease like malaria that is accounting for 29% of the total deaths. And there is HIV prevalence that is quite high, of 14%, not to talk about tuberculosis. Something very important that I want to mention that is later important for my talk is also the human resources for health. So doctors, nurses, midwives are quite scarce in terms of numbers. And this is not really contributing to having a good health system in place here where when people need cares, actually.
So just to put this a little bit in perspective for our viewers, the number of physicians in Germany with a population of 85, 86 million, so let's say 3 times your population, we have 400,000 physicians. If I calculate back, your number of doctors, nurses, midwives is much less than 30,000 for a population that is 1/3. So you should have 150, 100,000 doctors for the country just to give a comparable staffing. And I remember not from Mozambique, but from Cameroon, I remember healthcare expenditures per year per capita is 53 euros. In Germany, it is 5,600. So what you tell us, and with all the basic numbers that you gave us, this is very different type of medical care setting that you are working in.
It is. You're very correct. If I can't really remember the figure for the health expenditure per capita. I think it's around $40 to $50. But don't quote me on that. I'm not sure about my figure. But yes, even though there is a lot of money from the international aid that comes to Mozambique in the healthcare system, there is very few of domestic funding that goes to health. Although there is like a tendency nowadays to really try for government to chip in more into healthcare so that there are more sustainable way of providing healthcare to the people. But yes, it's a completely different system, and it works more with actually community health system that maybe I'll talk a bit later, than with former doctors and nurses and surgeons, because they just don't exist here.
Very interesting. Now, in that type of setting, maybe you can give us some examples of project that you have been working with to see, where were investments, where were you engaged, and where did you try to make a difference?
Yes. So my first experience in Mozambique was very much, as I mentioned, on HIV and TB patients, because there's a high there are higher incidence of those diseases. So really trying to bring them the best access to diagnosis and care. So going to the field, to the patient, and to try to understand what was the limitation, what they were needing. For example, they would need counseling, and there is no healthcare, staff to do that. So we will be relying on what we call lay counselors, that are people from the field that are actually trained to give them support, because you cannot give only IRVs to a person without explaining what's going on, how the disease are going to evolve, how they need to be retained in care, and how they need to live with that disease. So they need this kind of support. So I would be advocating for this kind of lay counseling to be part of the health national policy for HIV and TB people. That was one of the examples. Then I work with Pathfinder, a US organization or NGOs, and it was to support mothers to take postpartum contraceptive. So I was working in maternities around Maputo and Matola, two areas close to in that region where I am right now, to really try to promote those contraceptive and work with nurses so that they can also do the same for the patients. Then I work with NGOs that actually did a mass media campaign to support or to push parents that have very young children that are sick to seek treatment and bring them to the health centers when the kid is dehydrated or he has a fever, to not wait at home, because what people do most of the time, the health center is so far away that they wait at home. So we design mass media campaign with very strong messages that the population could really relate to, so that they will understand every time that the kid has this and these symptoms to bring their kids to health centers. So it was a lot of work in the field with the people, trying to understand what message they understand, in which language they will understand, and what makes sense to you doesn't make sense to them. So you really have to work with what is the perception of health of the population. That's a very interesting work. I did a bit the same with UNICEF when I was working in a polio vaccination campaign. So my role there was to make sure that parents were actually allowing the health staff to vaccinate their kids with the polio oral vaccines. And it was a lot about, explaining what we were doing here, what was polio, why we need to vaccinate, etc., and making sure we are not leaving any child behind without a vaccine. So that was a lot of working in the field with the local authority, with the community, with the leader in the community, to have access to those people and making sure they're receiving the healthcare, the vaccination in the right way. And recently I was working on the other side with the donors, so with the UK government, and it was quite of a different kind of work. It was more like I was overseeing the portfolio that the UK was giving, the money that the UK was giving to Mozambique for healthcare work. And so I was working with implementing partners like WHO, UNICEF, that were implementing intervention to decrease maternal and child mortality. So my role was to making sure the money was well spent, that the intervention well chosen, and also go in the field to check that everything that has been bought for the project is value for money, that is having an impact, that is being used. And also another side of my work was to work together with, big stakeholders like the World Bank, the Gavi, the UN, to make sure we are supporting the Ministry of Health to strengthen their health system, and have a lot of dialogue around what needs to, to kind of be reformed in Mozambique. So less field work, but very interesting as well.
Yeah, I think this makes you the perfect healthcare expert, not only for Mozambique, but also for countries here in Europe, because you know how to get things done and how to run the show in medicine. I think you have great qualifications for more, right? But that is only one aspect. What I cannot quite understand, or what I don't see yet, what does your day look like? Are you sitting at a computer all day with a telephone, or are you out in the field and delivering care, or are you negotiating with a lot of people? What do you do on a daily basis physically?
Yes, so it all depends. When I was with NGOs, it was much more on the field. So going to the field, going to health centers, meeting patients, talking to them, seeing what else they need. Is the healthcare properly given? So it was really much being in the car, going to really a very remote area with a lot of back pain most of the time, and spending the day talking to nurses, patients, etc., and relaying information back to government and to partners. That's it. And in the last 2 years with the UK government, it was more being in front of a computer, doing a lot of project management, going to meetings with the ministry to talk about health policies in general. But that's a kind of a mix of field work and computer work, if you want. This is how my day looked like.
Now, from all of that, and you have been working in Mozambique for 10 years now, what are your perspectives looking back on what do you think, what needs to change, what needs to improve? What are your take-home messages for someone who wants to get an impression on what is needed for the country in the future?
Yeah, that's a very good question. Look, it's been quite intense working 10 years here. I am a bit tired, of course. I think everyone that comes and embark on this journey of development work should not stay too long somewhere, because you tend to be frustrated with how things are going. But in general, there has been a lot of good things, and things that have improved. Kids are less dying, mothers are less dying. I also remember, like, I've saved a couple of lives, finding people in terrible condition and referring them to a health center or helping out. So it's good. It's a good work, and I'm very happy about it. Of course, there are things that can be done better. And I think for me, the main bottleneck for sustainable health in Mozambique are basically, the lack of education. People don't really understand why you need to stay healthy, why you need to be healthy. And therefore, there is not so much of an impact sometimes on what are the interventions, because it's just not, many people don't really understand, why you need to take a vaccine, etc. So for me, it goes together. Healthcare goes with education, and those are areas that should be prioritized by government and rethink a little bit. And also, one of my other take-home message is that instead of thinking of too complicated things, let's sit with government and ask them, what is it that you're looking for? What is for you a good health system? What are the basic needs? Because sometimes you really try to go over the top, but the basic needs are not there. So for example, some health centers still don't have water, electricity, commodities, surgical material, etc. So before, embarking in other battles, just let's, hear from government, what do they want? And sometimes I believe us, donor or development partners that are coming in those countries don't listen sufficiently to what government wants. And we should have this discussion instead of, thinking that all knowledge of it is the truth. Maybe it's not the truth for them, and there is other ways to do things. So I think for me, it's like the all development aid area should be rethought a little bit. And really health system strengthening. This is a very, I would say, a not sexy word, but a common word that is using nowadays, needs to be defined. What does mean health system strengthening for Mozambique? What do they want? And I think in Mozambique or in Africa, for sure, you need to put a lot of effort on community healthcare, because, it's a different setting. Things here don't work like they work in Europe. And it's a mistake to want to do the same as in Europe. You really need to live, and you really need to build the health system according to how the country look like, and not the other way around.
Interesting. From a 10-year perspective, this is advice well taken. I have one last question. And the question is, if I would give you 1 billion euros, and don't worry, I don't have $1 billion or euros I could give over to hand to you. And if I would tell you, take this money and make an impact on healthcare in Mozambique, what are the 3 items? What are the 3 priorities where you would spend the money?
Yes. So as I said at the beginning, for me, fundamentally is human resources for health. It's not sufficient. People need to be trained. People need to be paid well. The few nurses or doctors that are here are overwhelmed. They are paid nothing for the work they're doing. And they need to be encouraged, and they need to be recognized. And you need to, have so many more than what we have right now, because without anyone knowing or having the skills, you're not going to go further. So that's the first thing. I will really invest in this, training people, education, and paying them very well. That's one. The second will be rebuilding the logistics and procurement system in Mozambique, because there's a lot of drugs or medicine that are coming into in the capital, but then how you send it to the province, how it reached the health center in the middle of nowhere, this is another story. And sometimes as well, the medicine that have been ordered are not there anymore. You need to really make sure that an HIV patient that is on a treatment and his life is depending on that medicine can have it. He's done the effort, to be on a treatment, to be there in the health center. He's been walking maybe 15 kilometers to get there. You cannot say just to him, we don't have the medicine, while it's in country, but he did not reach that health center. And that person then will be again, infectious with HIV. This is just not possible. So this needs to be rethought. Strengthening the logistic and procurement system in Mozambique, maybe through public private partnership. I don't know. That would be a very good solution, because a lot of private companies know how to do, how to deliver, stuff. So that would be a great thing. But I think it's essential. And the third thing, I think, as I mentioned, is the community healthcare. So making people in their little village the leaders, the community leaders, the patients, civil societies as well, be, part of the healthcare system. Not, maybe we would never have here so many nurses and doctors, but those people, you can train people that are quite knowledgeable around, basic healthcare, like how to recognize a child that has malaria, how to make a malaria test, or to give an implant to a girl that will be sexually active. All those little things make a difference. And you have to organize and train those people in the little village, that they can rely on the system that works for them instead of having to go to a health center. And to reorganize their healthcare and to get access to those people as practical as it is for them. That's basically will be my 3 shots. I think there are more, but yeah, I will do like that.
You only have 3.
1 billion. Okay, and only 1 billion.
Yeah, this was a very nice last summary. So basically it is education, it is logistics and infrastructure, and it is a focus on public health. Simple things that matter and that make a difference in surviving.
Yeah,
very interesting.
Health.
Delphine,
yes.
I'm very, very grateful for your time and very, very grateful for your insights. This was our Global Healthcast special today on September 6th. Please like, share, and leave your comments below. Thanks for joining us today. I am Joe Schmitt, and I say goodbye.
Goodbye. Thank you, Joe.